Like I said earlier, we have terrible habits sometimes. Maybe ni mimi too, but you can share with us. You have that cough syrup that's been on the shelf for a while. Ikirudi tena unaenda unachukua, angalia expiry date, ama mtu mwingine akigonjeka kwa nyumba, you pick medicine ya nani, unapatiana kwa nani. No, we self-medicate. We just go to the chemist and be like, ama unatumia tu vitu ufai kutumia. Now, having this conversation with us is, I don't know how to say, it's Dr. and Dr., Mr. and Mrs., I don't know. But we have Dr. Gideon and Dr. Jacinta. Welcome to the show.
Thank you so much.
And kindly introduce yourself properly, now that nimeshindwa nieke easy titles aji.
Okay. My name is Dr. Mwende. I'm a dentist by profession. I graduated in the year 2018 from my university. I am also a beneficiary of Equity Leaders Program, year 2012. And I am so happy to be here. I'm just basically going to talk about dental health. I have a keen interest in orthodontics, which basically is about alignment of teeth. And that is where my heart is. So,
Okay, okay,
yes.
Great. Dr.
Yeah, good morning. My name is Dr. Gideon Karaoke. I'm a graduate of Moi University School of Medicine. I graduated in the year 2015. I did my internship at the Level 5 Hospital.
Yeah.
And currently I'm actually in healthcare entrepreneurship through Equity Afia. I'm a master's student in business administration at the University of Suffolk. And basically I've done several other courses, business related and healthcare related, which puts me at an advantage to practice as a doctor and as a manager in healthcare service delivery.
Okay.
Yeah.
Even before we get to our problems, sisi kama wa Kenya, watu tuna watch TV huku leo. Maybe you can tell us a bit more about Equity Afia. What is that about? What is it?
Well, Equity Afia is a comprehensive outpatient service provider, which was started by Equity Group Foundation. And it was started in the year 2015. And the intent was to provide quality and affordable healthcare services to most Kenyans. So we provide comprehensive outpatient services which engage doctor's consultation. We have both GP and specialist services. We have a pharmacy which is well stocked in terms of both original and generic medications. We have a well-equipped laboratory. All our labs are in the Class E category. When it comes to lab classifications, usually we have Class E as the second highest classification. We also provide other services like antenatal clinics. We do immunization, family planning. We have also dental and optical services. We also provide emergency care. So in terms of comprehensive services and a family-oriented setup, Equity Afia is the place to be.
Okay,
Yeah.
great.
Yeah.
And I think now that that's out of the way, we need to get into our habits. You know,
yeah.
how we seek, medical attention, how we self-medicate. And probably, Jacinta, you'll be, or do you prefer Mwende?
Yes, Mwende.
Dr. Mwende.
Yes, I do.
When you look at how we handle maybe our teeth and our mouth and, taking care of ourselves, do we do a good job? How would you judge us? Being the experts.
I think there is a lot of ignorance and a bit of neglect when it comes to dental health. It's not only in terms of patients.
Yeah.
Also in terms of the setup, in the hospital setup, you'll find that actually the dental sector is a bit neglected. And this actually translates to to a whole health system whereby oral health is not given a priority. You'll go to hospitals and you find that in the sector for medicine, everything is in order. But when it comes to dental, actually you will find that it's not well equipped.
I have to agree with you.
Yes.
Recently, a friend of mine went to hospital. We were not naming names. And they had other issues alongside Meno in Auma. And they were treated for everything else. Everything was taken care of, but they had to be there from 6 is when they showed up.
Yes.
By maybe 10, 11, they were done with everything else, but they left at around 3, 4 because uko kwa Meno, mtu sijui ako wapi, alienda sijui wapi, hayuko. So it starts from there, then hata sisi wenyewe we are not even helping in the way we take care of ourselves. But what you're saying is very true.
Yes. So I would say that actually oral health, we need to put more emphasis on oral health from the individual level to actually the whole government and in terms of organization.
Okay.
Like even when you come to the hospital, you'll see like the patient comes in and they're like, daktari nauma nitoe tu. But me as the dentist, I have to look at you as a whole person.
Yes.
I'll ask you so many questions. I'll ask you about your general health. I'll ask about your hypertensive, if you're on medication, because I have to treat you as whole.
Yeah, and that's
No.
just one part of our health, because
Yes.
imagine,
Yes.
Ioni, oral health peke yake we are not even taking care of, or we are not, or something is off.
Yes.
What about the other part of us? You know, when we have a headache, when you have unasikia mgongo fani, then you decide kuambia mtoto wako asimamie akukanyage mgongo. We don't know what that is doing to
Yes,
you.
yes.
We're taking a very short commercial break, but if you have any question whatsoever, please do ask, because we have experts in studio. When you come back, Gideon will be telling us about our terrible habits and what we need to be changing. But please send in your questions. 111 We'll come back with Gideon and Mwende in just a bit. Welcome back to Full Circle. We're talking about health-seeking behaviors by Kenyans. What is it that we do? And I have Dr. Gideon and Dr. Mwende in studio. And just before the break, Dr. Gideon, I was asking you, what are our habits, you know, when it comes to seeking medical attention?
Well, when it comes to seeking medical attention, there are several things that we look into.
Okay.
And currently, as compared to previously, things have changed. Initially, there was a problem and challenge with the cost, and that is the affordability of healthcare services, as well as accessibility of these medical services. And that's where we saw a mushrooming of chemists and so forth, where people now opted to self-medicate themselves.
Yes.
But currently, with increased access, especially through the equity affair model and affordability, then it becomes very easy for people to be able to seek medical services from their neighborhood. And when it comes to health services, the problem is that most people seek curative services. But in medicine, we approach it in two perspectives.
Okay.
There's what we call preventive medicine. Preventive medicine entails three things. There's what we call primary prevention. Primary prevention is when you take measures to prevent a disease from occurring. For instance, you could be coming from a family with a family history of hypertension or diabetes. So you take necessary precautionary measures to prevent you from getting this disease. For instance, you can engage in a regular exercise program, observe your dietary habits, check on your weight, that is lose weight, and that will actually reduce your risk of developing hypertension or diabetes. Then there's what we call secondary prevention. Secondary prevention is when you take the necessary precautionary measures to prevent the complication of a disease. For instance, someone is hypertensive or they are diabetic. In that particular regard, taking regular medications, being on a regular follow-up, being compliant to medications, it basically puts you at reduced risk of developing some of these complications. For example, someone who is not compliant to hypertensive medication, they might end up getting a stroke. Because remember, some of these diseases actually they do not have symptoms, especially when it comes to hypertension. Occasionally, some people might develop a slight headache, and that's why you find that even in some of the painkillers, they normally insist, or even some of the medication normally insist, if symptoms persist, seek medical advice. But you find that in some cases, people rarely seek the medical advice. They only go to hospital when the complication has already occurred. Then there's what we call tertiary prevention. Tertiary prevention is when you take the necessary precautionary measures to prevent further complications from occurring. Let's assume someone is hypertensive, they have already developed a stroke, and they're bedridden. You find that in some cases, because of immobility, there's a condition, we call it DVT or deep venous thrombosis. You might find because of immobility, you develop a clot in the veins of the leg. The measures that we can take when it comes to tertiary aspect is perhaps engage in a regular physiotherapy, or actually encourage mobility for this kind of patients. When it comes to curative services is when you go for treatment for a disease process. Unfortunately, in our setup, one of the bad habits is that we, as Kenyans, we only think, or in developing countries, we only think that we can only go to hospitals to be treated, but not to be checked.
So
Actually, you
don't
find
do a
regular
checkups.
checks.
Yeah.
I've come across several clients, some who are very well educated, but you find someone is either hypertensive without their knowledge, or someone goes into stroke with them without their knowledge that they were previously hypertensive. There was a recent occurrence whereby someone never knew he was hypertensive, driving a very big car, and was found actually by the roadside. The car was parked by the roadside, only for people to break in and find that the person was somehow unconscious, to be taken to hospital, and was noted actually this person is hypertensive, diabetic, and he had already developed complications. So when it comes to health services, I think it's important for us, especially in developing countries, not to only seek curative services, but also to go for the preventive medicine aspect, because you find that especially with the insurance and so forth, there usually a package that is provided to patients. We call it a wellness package. This means that you can go to any facility, walk into any facility, and get a regular checkup. You can discuss with the doctor, then they can be able to assess your need and be able, depending on the budget that you have, they can be able to advise you which particular test you can be able to do. For example, we normally say, especially, let me give a good example of a disease process that is easily preventable and easily treatable in the early stages. That is cervical cancer. We normally say cervical cancer is preventable.
Yes.
We have the vaccines, and through proper screening and regular checkups in the early stages, it's curable, or it's treatable, it's manageable. Unfortunately, rarely do most women go for what is called the pap smear, which is quite affordable. You find it most
How
facilities.
regularly should a woman go in for pap smear?
We normally say on a 3-yearly basis.
Three-yearly basis.
Yeah, 3-yearly basis. But in case of anomaly in a pap smear report, basically you can increase the frequency in which you go for the pap smear. But there's 2 ways in which you can look at it. There's what we call the HPV testing. If you do the HPV testing plus the pap smear, we normally say at an interval of 5 years. But if you only do pap smear alone, which is readily available in most facilities, we normally say it should be on a 3-yearly basis.
And every year, I think we have all these hospitals put together for women to just go in, and it's free.
And it's free,
Inapanga mwezi gani? October?
No, yeah, October. Like, for example, at Equity Afya Juja and Equity Afya Roiro, we offering these services for free every Friday afternoon.
Every Friday?
Every Friday.
For free?
For free.
Lakini hatuna reason why not to.
So
we don't have a reason not to.
I don't think there is.
Would just say that again, and this is your camera, just for all the women out there who are just thinking it might be expensive or don't know where to go. Again.
Okay, we normally offer every Friday from 2 to 4. We offer free cervical cancer screening from 2 to 4 p.m.
Okay.
Yeah, that is Roiro branch, Equity Afya, which we are located along Mathigu Road, directly opposite Cooperative Bank, and in Juja, in a building known as Kalimoni Highway Plaza.
Okay.
So this is something
very powerful information, and thank you so much for that. And that is general health, like to wache kungojea. If you can just check in, go in, have a checkup done, usijipate kando ya barabara, not knowing what is happening to you. Just be in charge of what is happening to your body. Remember to send in all your questions, 111-444-111. That is our SMS line. We're taking them in. I can see them, and just before I get into them, when we talk about oral health, what is the one thing yenye tunafanyanga too wrong all the time when it comes to oral health?
Okay.
Or maybe if there's something we do right, you know.
I think the first thing that we do wrong is, like waiting for too long until the problem has already set in. because what you are encouraging nowadays is more of preventive rather than curative.
That's true.
Because curative is expensive.
Mm.
So most times when I'm in the clinic, 90% of the patients, they'll come when they're in pain already. Most of them will never come for regular checkups.
Yeah.
That we usually say come to the dentist after every 6 months.
After every 6 months?
Yes.
That's when? We should.
Biannually, yes.
But yeah, oh, I'm doing terribly.
Twice a year.
Okay.
Come to the dentist for just checkup. Checkup means that you're going to examine you. We usually look at the mouth, each and every tooth. Sometimes we take just x-rays just to confirm that you don't have any cavities or any pathologies that might actually be left out. Because you find that some of, most cases we have cavities, which is caries. So you find that there are some cavities that form katikati ya meno.
So we're not able to see.
So you may not see.
Katikati tu ya meno.
Yes, that is why sometimes we'll take those x-rays, and it's easier treated when it's small.
Okay.
Okay, because once it progresses, the treatment will now change. The moment you're in pain, the treatment changes to something else we call root canals.
Yes.
It can even go to extractions. It can even purpose surgeries. We have surgeries in the mouth that we do. So that aspect of waiting for too long until you're actually in trouble to see the dentist, that is where we are failing.
So we should stop that.
Come
Two times
to the
a year.
dentist. Come to the dentist.
And this is also offered at Equity.
Equity Afya, all the clinics, they have a dental department. Our consultation is only 500 Kenya shillings.
Okay.
So kuja, yes. Imagine you come, I do all that checkup for only 500 shillings.
Ukweli?
Yes.
Hata hiyo x-ray?
Anu, x-ray iko kando.
Ningesema nitoka na nyinyi hapa, show ikiisha siwaachi.
So the other thing that you're actually doing wrong is brushing techniques.
Oh, okay, please.
Brushing is just not about picking your toothbrush and doing all the movements that you feel they're right.
Okay.
There is actually a brushing technique that we usually
recommend.
It's called a modified burst technique. You get your toothbrush and you do in circles.
Okay.
Small circles. Because if you look at the shape of your gum, it's like half a circle.
It's not like this.
Don't do horizontal.
Okay.
The moment you do horizontal, you start cutting the gum, and then it starts going down. And then from the gum, now it goes to your tooth. And then this thing develops over time. So by the time you're getting older, a bit, 40, 50, that is when it starts showing. So the brushing technique, circular motions, all the surfaces, only on top of your teeth is where you do like the horizontal, just on top. And then you take your time, like 3 minutes.
To sugue meno 3 minutes.
Don't be in a hurry. Yes.
Don't be in a hurry.
Yes.
3 minutes, guys.
Yes.
Okay.
Yeah.
We, maswali basi, kabambe. Haya, kuna mtu anasema, please ask the doctor, do they take insurance for dental?
Yes, we do. We take like a wide range of insurances, like almost all insurances we take.
Okay.
Yes.
Hi, Mukalia Marcus Wandera. I would like to ask how I can get rid of Pimples completely. I don't know. Pimples sounds like, I don't know if you, Pimples iko angelektia kujipaka hivi kwa uso kama powder. I don't know. I think maybe Pimples.
Pimples.
Yeah.
I think
that's you?
I think we'll encourage the viewer basically to seek dermatological services, because when it comes to dermatology, usually there's some condition which are almost similar, and definitely management differs. So the best advice I'll give the viewer is actually to visit our dermatology clinic.
You have that?
We have a dermatology clinic every Monday at Equity Afya Kasarani from 11 a.m. to 1 p.m.
Okay.
Yeah.
Hi, mimi nilioshwa meno, but they are very sensitive. This is the 2nd year. He's called Alan.
Alan. Okay. When it comes to sensitivity after cleaning, most of the times it depends on I would call the amount of dirt. You see, when you're cleaning, if we say come after every 6 months, we are trying to prevent. that kind of dirt from forming around your teeth.
Okay.
So you might actually come to the clinic when your teeth are clean, then I'll tell you we need to clean again. Reason, this is more preventive, okay? But then when you stay for long, 3, 4, 5 years, that kind of dirt, we call it calculus, it accumulates. It actually attaches to your teeth. There is a bit of chemistry involved. The food that stays for long in your teeth, it hardens, and then now it gets attached to your tooth. So for me to pluck out that kind of dirt,
You have to dig deep.
it's not really digging. I have to remove it, and then
Are you
after
scraping
removing
it
it,
off?
yes, we do that. It's not really the cleaning that causes the sensitivity,
Okay.
but once you remove that kind of layer, your tooth is exposed. You know, it's like umevaa nguo warm and then you're exposed.
Okay.
So you tend to get that kind of sensitivity for a while. So when you go to the dentist, after that, when it's a lot of that, most dentists will tell you to use Sensodyne. Sensodyne, it actually, once your tooth is exposed, it means like there are some very tiny tubules, we call them dentinal tubules on your teeth, like they're open. So when you use Sensodyne, Sensodyne blocks them with time. So after a few days, 10, 15 days, that sensitivity will now go away.
Okay.
Yes.
Kindly encourage that patient to come to our facility.
Yes.
So,
Alan, hawa wamekwambia uje.
yes.
Salimia hao madaktari Mwikali, loving the show. Kindly ask for me about missing teeth zile zimeng'oka. It is okay to live. Is it okay to live without a tooth, and how much does it cost to replace one? We are to Fatma from Kabete.
Okay, so in terms of replacement, there are teeth that we don't replace, and there are teeth that we replace. Teeth that actually show on your smile line, once you smile, those are teeth that we have actually to replace.
Okay.
The wisdoms, we never replace.
At all?
At all. We never replace wisdoms. Now, in terms of replacement, nowadays we have only two types of replacement that we as dentists we are encouraging. The first one is the fixed one, that is called an implant. An implant is more of, where the tooth was removed,
Yeah.
just that space where it is, we come and plant another artificial tooth.
Yes.
With time, that artificial tooth, it bonds with your bone. So it becomes like part of you. It's like more of there's a screw that is made of metal,
Okay.
titanium. Titanium, like we call it osseointegration. It becomes part of you. So that is
today.
so that is more of a fixed one.
Okay.
The only challenge or the other, it's just the cost implication. This one
okay.
is a bit higher.
Okay.
It will cost you from around 150,000, but it is good.
Okay.
The other one is the removable one that you have to put at night, during the day, and then you remove at night.
Hii ile tunaonanga tushaweka kwa glasi ya
Yes,
maji.
hiyo.
Ah,
Sasa hiyo huwezi lala nayo. If you sleep in it, it causes gum problems. Yes. So those are like the two. The other one is a bridge, but nowadays we really don't do bridges because it means we have to cut the adjacent teeth to support the bridge.
Okay.
Yes, so nowadays we're not doing bridges. The issue with replacement, it's good, especially for teeth that are, teeth are in contact, the upper and the lower, they meet like this. So the moment you pluck one, the other one starts to elongate.
Oh.
So you find
This is me feeling my empty.
So with that kind of elongation, there is usually a lot of occlusal, what you call occlusal changes. And then with the elongation, you're not able to brush past the elongated tooth. So you'll have challenges cleaning in between, and then you start getting cavities.
Okay.
So that is why we say replace.
Okay.
Yes.
Wow.
Yeah.
Our time is almost up. Maybe Dr. Gideon, you could tell us what is it that makes Equity IFS stand out from all the other maybe health centers that have been there. It's considerably new. Looking at what has been in the market for the
some
longest time. Yeah.
One of it is quality.
Clearly.
We normally, some of our, for patients, especially because we're basically based in Equity IFS Kasarani, Roiro, Eastern Bypass, and Juja. And in the other Equity FA, basically we have a dental department. We have ensured that one of the things that we do is to ensure that you have the right quality, in the sense that our services, dental services, are provided by dentists. And it's very easy actually to do whether you're being attended by a dentist. You just ask for their registration number, and you can be able to check it from the board. There's a list, a register from the board register. Yeah. The second thing that we look into is affordability. Our services are very affordable. For like a GP consultation is only 500 shillings. For a specialist consultation, there's only 1,500 shillings. We have, for example, let me give an instance. We have a cardiologist on board. You find him in other high-end hospitals, he will charge you 5,000 for consultation. But you come to our facility, he is bound to charge only 1,500 shillings.
Really?
Yeah. So the third thing that we look for is accessibility. We are not only based in high-end areas, we also based in low-end areas, so that we ensure even the mama mboga can be able to access
that facility
at
a good price.
At a good price.
Okay.
The fourth thing we normally
final thing
almost is flexibility.
Yes.
We never turn away patients. Someone comes and say, "I have 500 shillings. This is my budget. This is how I'm feeling." We customize that budget as per their needs. And sometimes we also offer pro bono services. But for those people who can be able to afford, we encourage them to pay, so that we can be able to help someone who cannot be able to pay. As a parting shot, I'll encourage our viewers to visit our facilities. We have 41 branches spread out throughout the country, and we have 24 insurance partners. We accept cash payment, M-Pesa. Some of our facilities are NHIF accredited. Come and experience quality, affordability, and accessibility. We are in our neighborhood.
Okay.
Yeah.
Asante sana. Jacinta Mwende, please give us your number for consultation. It's Phoebe from Karatina. If you're not comfortable, it's fine. Social media handles for Equity.
We will give them the clinic number. We have 0765 00 046, 0765 00 062, 0765 00 006.
Okay.
Yes.
Asanteni sana. Our time has really run out.
Okay.
We're going to take a very short commercial break. When we come back, we have the Royals Coffee and Andy coming in for some fitness. We'll be right back.